Healthcare has certainly been advancing with great breakthroughs in technology. Medicines, machines, and methods all have done great good. But even as medical treatments advance, the balance of nature can present challenges that often remain elusive to the most sophisticated technologies and therapies. Clostridium difficile, commonly known as C. diff, has recently emerged as one of these challenges, and left unchecked, it can lead to devastating and even lethal outcomes. The suddenness of an individual's C. diff infection can be overwhelming to a patient, and the incidence of C. diff in hospitals is clearly on the rise.
The patient with C. diff diarrhea came in, and all she had had was a root canal surgery and antibiotics for about 7 days for an infection. A week after those antibiotics, she was admitted with dehydration, diarrhea, and in spite of IV fluids, antibiotics, and constant monitoring, she died within 48 hours. C. diff can be a wide range of symptoms. It can be very mild or it can be severe. But increasingly over the last decade, we have seen that it's becoming more dangerous. The organism has become more virulent. It produces a toxin which is more powerful. It damages the colon and simply drains the fluid out of the body and weakens the person. Most people will have a miserable time with this disease. Running to the bathroom every few hours or every few minutes, watery diarrhea, no appetite, fever, abdominal pain. This is just miserable. You don't want to be there.
We know what causes these infections, and we know how they occur.
The large intestine or colon typically contains trillions of normal healthy bacteria, and that they actually help keep you healthy, help you digest food, etc. When people take antibiotics, that kills off the normal bacteria and allows this C. diff to overpopulate, and then it produces toxins, which can then cause diarrhea. C. diff is normally spread what we call hand to mouth. The surfaces get contaminated by the C. diff spores, or people's skin can get contaminated. And then if those people touch other people, or unfortunately if healthcare workers touch those patients with C. diff and then go on to touch other surfaces or other patients without thoroughly washing their hands in between, they can then spread the bacteria. And once it's on a skin surface or any other surface, and then you touch that surface and then touch your mouth, ingest those spores, the C. diff bacteria can then germinate and reproduce in the body. More severe cases will be associated with higher fevers, high white blood cell count in the blood, and then expansion of the belly, expansion of the colon, eventually requiring surgery.
Our staff at Christiana Care Health System is acutely aware of how serious C. diff is, and we've adopted an entire regime of safety precautions to address this growing problem.
One of the goals of Christiana Care is to serve our neighbors as respectful, expert, caring partners in their health. Specifically for C. diff, we do a number of different things, including daily surveillance, where we look for every positive C. diff test that comes through our lab and make sure that those patients are rapidly identified and put into isolation.
From the education of the staff with what the spore is, to the appropriate hand hygiene precautions we put into place, the usage of our bleach disinfectant, the changing of cubicle curtains, ensuring that the surfaces are disinfected appropriately are several of the things that we've done to make sure that we're on top of our game with regards to infection rates.
We are worried about patients demanding antibiotics, for example, for a fever. And we try to tell them, you don't need this antibiotic. You don't have a bacterial infection. You may have influenza. This antibiotic will not work for you. It might kill you.
Though hand washing is perhaps the most effective way to avoid the threat posed by C. diff infection, relying on human behavior is always a risk. Knowing this, Christiana Care is employing the latest technology to ensure the complete safety of our patients and our staff. Ultraviolet exposure in rooms where C. diff can do the most harm.
Above and beyond what our regular protocols are, we added a True D system, it's called. It's a rapid room disinfection system. It uses UV light. UV light renders a spore unable to reproduce. And that's what occurs with the UV light when it hits a surface. Anything near or on that surface actually is rendered unable to reproduce, and that's what we have to have. When the machine is turned on, once all the safety precautions are in place, the machine is turned on and the light actually reflects off all the surfaces, and the reflection of the light comes back to the eye, where the eye can tell us how long it needs to run in a certain area so that surface, whether far away or close, is disinfected for the C. diff spore.
C. diff, just one of many challenges that Christiana Care is addressing in today's complex environment.
We really try to focus on 3 different areas, the teaching and education, so that all of our staff members are aware of C. diff, know how severe it can be, and know that they themselves have things that they can do to prevent its spread. The traditional methods that we have always been using, such as isolation, hand hygiene, and making sure that those are done consistently and rapidly. And the new technologies, which include better lab testing so that we miss fewer cases and we don't leave people undiagnosed, as well as the new ultraviolet light disinfection, which will help us to further reduce the spores in our environment. All these things together will hopefully help us to continue to reduce C. diff into the future.